Hi viewers, today we'll see nursing care of patients with leukemia. I am Dr. Kalaiselvi Xavier, Professor, Tribhulam College of Nursing. What are the objectives of today's class? Today we'll see end of the class, the students will be able to mention the meaning of leukemia, classify the types of leukemia, explain the signs and symptoms of leukemia, specify the diagnostic evaluation of leukemia, enumerate the management of leukemia, explain the nursing management of leukemia, and list down the complication and outcome of leukemia. Leukemia is the type of cancer which affects the blood cell. This entails the proliferation of abnormal immature white blood cells. These white blood cells are accumulated in the lymphoid tissues and bone marrow. When the person diagnosed as a leukemia, it produces uncontrollably and infiltrate the body tissues and blood vessels. This will eventually lead to malfunction due to hemorrhage, enlargement and infection. This can be further classified as acute, which is rapidly growing, or chronic, which develops more gradually. Meaning of leukemia: a malignant progressive disease in which the bone marrow and other blood forming organs produced increased number of immature or abnormal leukocytes. This suppress the production of normal blood cells, leading to anemia and other symptoms. This is the normal pathophysiology and action production of the cells. The blood stem cells, it is divided into myeloid stem cells and lymphoid stem cells. When the lymphoid stem cells become a lymphoblast, and it is divided into P lymphocyte and T lymphocyte and natural killer cells, and later on it become a white blood cells. Here the myeloid stem cells, it become a myeloblast and red blood and platelets, and it's act as a white blood cells. Types of leukemia: there are two types. Acute means the type of leukemia entails a profound percentage of such immature cells and tends to progress rapidly if chemotherapy is not provided. In fact, the acute leukemia is already considered as a medical emergency. It requires hospitalization and initiation of the therapy within hours of time once the patient is diagnosed. The chronic also, it is a condition, lower percentage of immature cells. It is significantly highly proportion of immature cells, unlike acute type. This condition may progress slowly and may also not cause manifestation for years. Now we will see detailing about acute leukemia. There are two types: ALL. ALL means acute lymphoblastic leukemia. Then AML, acute myelogenous leukemia. What is ALL? This type of leukemia is commonly seen in children but may also occur in adults rarely. The body produces too much white blood cells that causes infections, anemia and bleeding. What is AML? This affects myeloid cells and grows quickly. The disease processes faster than other types. It occurs both adults and also children. This can be seen in men than in women. This is the division as we explained, seen in that previous slide. What the pluripotential stem cells, it will undergo the influence of cytokines due to the etiological process. The committed stem cells, it is the lymphoid cells become lymphoblast and pro lymphocyte and become a acute lymphocyte leukemia. Then this side, the white blood cell become a myeloblast, promyelocyte, and become, which leads to acute myelocytic leukemia. Then now we'll see chronic leukemia further explanation. What is CLL? What CLL means chronic lymphocytic leukemia. It affects lymphoid cells and usually grows slowly. Most of the time diagnosed in men 55 years old. This is a slow progression disease. The other one, it is a CML. It is a chronic myelogenous leukemia. It is a mostly commonly we can see in adults. This will affect the lymphoid cells and in the bone marrow. Before to see the signs and symptoms and all, we'll see what is immature cells. This is a percentage of immature cells and proportion of mature cells. Determines the distinction between acute leukemia and chronic leukemia. Instead of number of abnormal cells found in the blood or the bone marrow. What are the risk factors of leukemia? There are the predisposing factors, hereditary, congenital chromosomal abnormalities, immunodeficiency, gender, genetic disorder, chronic marrow dysfunction. There are some of the precipitating factors, which is exposure to high level of radiations, chemicals and drugs, previous any other type of cancer treatment, or people are exposing to the industrial certain chemicals and which leads to smoking. Now we'll see signs and symptoms. There are so many signs and symptoms. The important signs and symptoms: loss of appetite, weight loss, fatigue, fever. Other which is related to bleeding comes, red spots on the skin, widespread bruising, purple patches under the skin, frequent or severe nose bleeds, fatigue. Fatigue means red spots on skin. And continuation of the signs and symptoms: anemia, paleness, malaise, dizziness, shortness of breath, rapid heartbeat, which are all due to anemia. Then frequent infection, cold sores, urinary tract infections, pneumonia, gums infection, infection in the anal area. And further symptoms, signs and symptoms: headache, vomiting, sore throat, bone or joint pain, night sweats, swelling of the testicles, vision problems. Further signs and symptoms: abdominal discomfort or feelings of fullness, bone or joint pain, enlarged lymph nodes, enlarged liver or spleen, discomfort in the abdomen, loss of appetite, losing weight without trying. Then we'll see what are the diagnostic studies. Usually the blood test, carcinoembryonic antigen may be elevated, CEA will be elevated. Cold agglutinins may be elevated more than 1:16 in lymphatic leukemia. Then cryoglobulins, it is a positive cryoglobulins findings may be present in the patient with lymphocytic leukemia. Then CBC indicates more normocytic, normochromic anemia. Then hemoglobin may be less than 10 grams per 100 ml. Reticulocytes count is usually low. Platelets counts will be very low, less than 50,000 per mm. Then WBC count may be more than 50,000 per cm with increased immature WBCs. The leukemic blast cells may be present. Other diagnostic studies: peripheral blood smear, it will be reveals the blast immature leukocytes, prothrombin time, activated partial thromboplastin time prolonged, LDH may be elevated, serum uric acid may be elevated, serum muramidase elevated in acute monocytic and myelomonocytic leukemias, and serum copper and serum zinc also. Serum copper is elevated and serum zinc is decreased. Furthermore, the diagnostic test, bone marrow aspiration and biopsy. Bone marrow is full of leukemic cells. Lymph node biopsy to detect spread of disease. Chest X-ray, lymph node biopsies may indicate degrees of involvement. Ultrasound provides visualization of the affected organs. Lumbar puncture shows whether leukemic cells have infiltrated the CNS. Treatment, stem cell transplant. The option is recommended for patients age 55 years old. Chemotherapy, this option is often the main treatment for the patients with leukemia and other forms of cancer. Radiation therapy, most often used in preventing spread of central nervous system as well as treating the disease per second and to prepare for stem cell transplant. Targeted therapy also, it is usually for a Philadelphia treatment, and supportive therapy intervention used to managing complication of treatment. Further supportive care for leukemia, fatigue. This is a known symptoms when a patient have a low red cell, low blood cells, and this may require blood transfusion. Infection, this develops due to low white blood cell count. Neutropenia is brought about by malfunction of the bone marrow or could be an effect of the chemotherapy treatment. Medication used for the symptoms are antibiotics and antifungals. Abnormal bleeding, this transpire due to low platelet count. This is also brought about by malfunction of bone marrow or could be on effect of chemotherapy treatment. The treatment provided for these symptoms is platelet transfusion to help slow or reduce bleeding. Then we'll see in loss of appetite. This is common symptoms for patients. This could be result of disease per day, and fatigue and depression and treatment. Then emotional health. During treatment, the patient experience overwhelming emotions, vast array and unexpected feelings, thoughts felt by the patients, adapting to the lifestyle, concerning the cancer will come back, thinking about the possible effects of cancer, side effects, family and friends, work and other significant others, anxiety due to loss of contact with the other healthcare team, questioning self-worth, identifying and alteration in appearance. Now we'll see important management of nursing care. Checks labs for coagulation parameters, check vitals continuously, provide skin protection, monitor for infection and sepsis, promote normothermia. Okay, we have to see the temperature regularly, educate the patients and family about management and further prognosis and treatment, monitor intakes and output, check if nutrition is insufficient or sufficient, promote hand washing techniques, encourage self, and also when to seek help and health institution. We have to inform the patient when the patient is having severe increased fever, severe hypotension, bleeding, loss of consciousness, altered mental status, severe bruising, pain and all, they have to immediately reach hospitalization. Then we'll see complication, frequent infection. The patient will have chronic lymphocytic leukemia. Sometimes infection happen because your blood does not have enough germ fighting antibodies. The doctor might recommend the regular immunoglobulin infusions. Then we will see the small number of people with chronic lymphocytic leukemia may develop a more aggressive form of cancer called diffuse large B cell lymphoma. Other complication, increased risk of other cancers, okay, the including skin cancer, and lung cancer, digestive tract problem, like that. Then immune system problems. The small number of people with chronic lymphocytic leukemia may develop an immune system problem that causes the disease fighting cells of the immune system. The outcome is a normal identification, normal appetite, vital stable, no signs of infection, afebrile, no pain, means the patient is betterment. The patient is improving from her conditions. Monitoring vitals, intake output chart, body weights, neurovitals, dehydration to be assessed, nutrition also to be watched, signs and symptoms to be monitored. Coordination of the care, usually for acute AML is a common hematological malignancies in adults. Despite many advances, malignancy still carries a poor prognosis. Hence, it is a most managed by the multidisciplinary team, includes the hematologist, oncologist, internist, pathologist, and intensivist. Oncology nurse is vital for treatment, administration, and monitoring for potential complication. The pharmacist should educate the patients on potential adverse effects of the potent drugs used to treat these malignancies. The primary care physician should educate the patient on personal hygiene, hand washing, and immunization. Overall, the life expectancy has increased slightly, but most patients have a markedly shortened lifespan. How to health educate and health promotion? Wash hands. We have to inform about five times hand washing techniques and the duration of the hand washing technique. Rinse all fruits and vegetables before eating. Avoid crowds. Maintain good personal hygiene. Daily bath and all to be explained. Follow up with the clinicians. Take medication as per regular prescribed by physician. Thank you.